In 2018-19, we received a financial allocation of £265.4 million. We spent £147.8 million on hospital, ambulance and other urgent care services, £29.7 million on medication prescribed out of hospital, £24.7 million on primary care, such as GP services, £20.4 million on community services, £19.8 million on mental health services, £15.1 million on continuing healthcare, £4 million on other healthcare services, and £3.9 million on CCG running costs. You told us it was difficult to get an appointment with a GP when you need one. We put in place an extra 13,586 evening and weekend appointments in 2018-19. Patients can also see a wider range of healthcare professionals at their practice. We worked with local patient representatives to help develop some materials that explain these new roles.
What we've really got is a care navigation system which makes a lot more sense. You know, the old thing has opened up a new ball game, and I think it's pretty important to go through that step.
Our Swift service is helping people stay at home for treatment. In 2018-19, the team saw more than 1,500 patients, avoiding 243 trips to A&E and saving 962 unnecessary admissions to hospital.
I have to say the treatment has been absolutely fantastic. The nurses are cheerful, kind, knowledgeable, and they've taught me a great deal about my problem, which I didn't prior know.
We participated in the rollout of the NHS Type 2 Diabetes Prevention Programme and introduced an additional 119 education courses for patients.
People don't realise they can turn it about, and they've got to be told you can turn this about if you do the right thing. The doctor told me to lose 2 stone, I've lost 6. But this is a personal choice. Once I'd lost the 2 stone, I felt that good. I thought, I wonder if I lose more, I'll feel better, and I do.
Our investment in mental health services includes an additional £77,000 to the Early Intervention in Psychosis service, with the introduction of a dedicated employment advisor helping people stay in employment and education. Following a successful pilot, the Mental Health Recovery College has been made a longer-standing project. It will be joined by a mental health wellbeing cafe that incorporates crisis support.
I was brought in at the end of 2018 to work with the Clinical Commissioning Group on the commissioning of the Recovery College and a wellbeing cafe. I was very proud that I'd been acknowledged for the work that I do, to be invited to be on the assessment panel.
You told us there should be more support for people living with dementia. 4 new dementia navigators are in post across Castlepoint and Rochford. 10 practices in Castlepoint and Rochford are now accredited as dementia friendly. We reached our target for dementia diagnosis.
There was a lady the other week, she came to the day we had in Knightswick, sort of like an information day, and she was very reserved, very cagey, very, I kind of want to know but I don't want to know. And she snuck in one day into my hub just to go to me. We come in here every week now, like to the club. She went, oh, I love it. She said, thank you so much. She said, if I need you, I know where you are. And then she toddled off. She didn't want nothing, didn't want me to know anything about her or her partner. She was just happy with that. It was the most bizarre thing, but sweet in its own way, because she had everything that she needed now to just move forward and carry on enjoying her life with her husband.
You told us that the communication about the importance of learning disability health checks should be better. We've been talking to local people about the importance of these checks and working with patients and their carers to develop a birthday card reminder. A project to improve detection and treatment of atrial fibrillation has seen mobile electrocardiogram devices distributed to our GP practices. Investment in a project to deliver a method for patients to cancel unwanted GP appointments via text or an app has freed up around 11,000 appointments for other patients to use. We show patient stories at every governing body meeting to understand what's working well or not so well with services we commission. Our Monday motivation campaign on social media has allowed us to highlight the great work going on across South East Essex. It is clear that working harder in a fragmented and reactive way is not the answer to delivering what is required of a modern health economy. The system needs to work differently by providing more care in people's home and the community, and by breaking down barriers to services and working with partners in a more coordinated way. We are committed to developing 4 primary care networks across Castle Point and Rochford to ensure even more care is delivered closer to home. A Mid and South Essex Sustainability and Transformation Partnership is already in place to look at services that can be delivered more sensibly on a larger scale, helping to promote consistency across the region. We'd like to say thank you to our member practices, partners, staff and most importantly, the people of Castle Point and Rochford for helping us achieve so much in 2018-19.